Afternoon and Happy New Year. It seems like it's been a lot more than 1 week into the new year with the events of the last few days, from the celebration of the historic results in Georgia, which are good for the city of Detroit and good for America, to the really disturbing events yesterday in Washington, to ultimately the certification of Joe Biden's election in 12 days. Hopefully this country will get back to working together. But we cannot afford to be distracted, because the stakes for the residents of the city of COVID vaccine are life and death. We know that. And the numbers continue to show that African Americans who get COVID are almost 3 times more likely to die than Caucasians who get COVID. The city of Detroit continues to lead this state in the low infection rate. We're either the lowest or near the lowest every day when the state reports come out. But we're the lowest because we're wearing masks, we're locked in our homes, a lot of our businesses are closed down, people are out of work, people can't make rent payments. None of this is going to change until we get enough of our residents vaccinated. We can reopen this city. And we want to talk to you today about how we're going about that. In all of yesterday's news, you may have missed the fact that the governor has significantly opened up the eligibility for who can get vaccinations. And she and I have spent a lot of time together. The initial rollout was vaccinations were sent to hospitals basically to vaccinate their own employees. That was fine, that made sense. But Michigan's getting attention for having such a low rate of vaccination. The reason is hospitals are used to having you come in and stay 4 or 5 days. They're not used to processing 500 or 1,000 people to get a vaccination. I think the governor is now shifting our direction, and we in the city of Detroit are going to be shifting, and the governor has committed that while she doesn't always know from 1 week to the next how many vaccines are coming from the feds, she's going to do everything possible to have a continual flow here so that we can start to vaccinate at the rates that we've wanted to. So the City of Detroit vaccination plan is now going live. And I want to show you how it's going to work. And for the next 3 or 4 weeks, we're probably going to have a number of these briefings, like we did back in March and April when we started the testing at the state fairgrounds. Hakeem Berry, our chief operating officer, was the brains of the fairgrounds testing. He's been very much in demand around the country with advice. He's now the person who's going to be driving the TCF Center. So let me tell you how this plan works and when you can get vaccinated and how. The city plan has 3 parts. 1, we are going to open up next week large-scale drive-through vaccination, basically for seniors, at the TCF Center. We are going to schedule 20,000 vaccinations in the next 4 weeks. That's what the governor believes she can get to us. If more vaccines come, we'll ramp it up, but that's what we are projecting to get. Our city workers are going to start to get vaccinated beginning tomorrow at their work sites, starting with the Detroit Police Department in DDOT. And then Denise Fair's outstanding team that did such great outreach on the COVID testing earlier this year is going to go out to our homeless shelters, to our senior citizen apartments, and they will reach out to those who are most vulnerable, who can't get to a TCF center. And over the next 6 weeks, they are going to be on site delivering vaccines at all 29 homeless shelters and all 60 senior citizen apartments. Those are the 3 pieces now that the city of Detroit is going to roll out. So let me talk to you first about the senior citizen drive-through vaccinations at TCF. We have to figure out how to prioritize, because we have 500,000 adults in this city, and if 40% want vaccines, that's 200,000 that want them tomorrow. And I think based on our surveys and the like, probably 40% would like a vaccine tomorrow, which means we probably got 200,000 Detroiters. It looks like, from my conversations, which match the surveys, I think 40% of Detroiters want it tomorrow. 40% of Detroiters think they should get it, but they don't want to be in the first wave. and about 20% are never going to get it because they don't trust anything that's been said. But even for the 200,000 that want it tomorrow, we are going to have to work really hard to get those folks in. And so the call center is going to go live on Monday, and we'll start giving vaccinations on Wednesday. Like the test site, you can't get a vaccination without an appointment. We're going to use the same process. Starting next Wednesday, we're going to put 400 through the TCF Center, and then by Thursday, it's going to go up to 600, Friday, 800, and by next week and every day thereon, we're going to go to 1,000, and we will ramp up as fast as the federal government sends us vaccines. We think we can do 3,000, 4,000, 5,000 a day if the vaccines are delivered, and I will show you how that's going to work. But given the fact that we have to start with 20,000, the question is, what's the priority? And what's going to happen starting on Monday, we're going to schedule the first 20,000 appointments. We're going to schedule them out for the next 4 weeks, so you'll know when you can go. So, who can call on Monday to get scheduled in the first wave? Again, we're going to start with those most in need. Any resident of the city of Detroit who is age 75 or older, if you were born in 1945 or earlier, you can call 9 o'clock Monday morning and get an appointment for your vaccination. It is an unbelievable number, but more than 1/3 of everybody who has died in the city of COVID, which is 1,700 people, more than 1/3 were age 75 or older. And so we could have tried to do this by alphabet or by geography, but our health department folks believe that those who are most in danger of dying should have the first priority on the vaccines. And so if you're 75 or older, you can call on Monday. Second, if you're a good neighbor to the 75-year-old and you're 65 or older, you can also call on Monday and schedule your vaccine. So another 1/3 of everybody who died in the city were between 65 and 75. So think about that. 2/3 of our deaths were over the age of 65. So here's what we're going to do. If you're over 65, you can call. If you and your spouse are over 75, you can both come in. But if you have a good neighbor who's willing to drive you, because not everybody who's 75 has a car, not everybody's able to drive. If you have somebody who's over 65 that'll drive you, they can get a vaccine at the same time. So we have folks in this city with a 67-year-old wife and a 77-year-old husband. We didn't want to be in a situation that the wife drives the husband to the vaccination site, watches the husband get vaccinated, and goes home. So if you're between 65 and 75, you can be a good neighbor. You can do it if it's the person who lives next to you in the senior center. Tomorrow, I am going to have a Zoom call with a lot of the ministers in this town. I think the churches can play a role in this. I want to get 65-year-old good neighbors partnered with somebody in your church who's 78 or 80 or 85 who can't get out. And if you will drive them, we will vaccinate both of you. And so our first 20,000 people are going to be largely either people over 75 or good neighbors who drive them who are over 65. Now, as fast as we get through that, we'll lower the ages each week and open up the eligibility. We want multiple people in the same cars. If you think about the logistics of getting these cars in and out, if we can have 2 people over 75 in the same car, that's great. If we can have a 67-year-old driver driving a couple that's in their 80s, that's great. We got 3 people in the same car. So we want multiple vaccine recipients in the same car if you can work it out. So I'd say to anybody in the city who's between 65 and 75 and really wants to have vaccine, reach out to somebody you care about who's 75 or older, call up and schedule them and come on in with them. So how's this going to work? The entrance to TCF is going to be on Atwater, right along the river. You're going to come in where Joe Louis Arena used to be, come right down on the river, but it's going to be inside the parking garage. You're not going to get out of your car. And so we call it drive-through, but it's actually drive-in and park. You're going to go into this enclosed parking structure. We're going to have heating inside. I won't tell you it's quite as warm as your house, but it's going to be pretty warm. You're going to drive in and you're going to park. And you're going to stay in your car with you and hopefully your good neighbors. You'll have to have an appointment. We'll know how many people coming in at 9, how many coming in at 9:30, how many coming in at 10. This is going to run, I suspect, as smoothly as the state fairgrounds ran in the way that we're doing this. So, what happens when you show up? So, you're going to come in past the old Joe Louis. You'll come along Atwater. You're going to have somebody meet you. You got to have your ID to make sure that you match the person who made the appointment. They're going to direct you into the TCF garage and show you where to park. And then you're going to park, you're going to turn your car off, and you're going to stay with the car. You don't have to do any walking. So people are worried, how am I going to get from the parking lot and walk all the way inside? No, you're not going to have to do any walking. We are going to have a team of medical and support staff to greet you. And they will come up to you and they'll verify your information and have you fill out your consent form. And so it's not complicated, the kind of thing you'd expect. We'd ask you, bring a clipboard or a book with you because you're going to have to write in a pen. You're going to have to write inside your car. But once you pull in, we're going to come up to you and explain this form, ask you to fill out the form, make sure we have your medical information. We're going to want to know if you had any allergies and other things that might have an effect on whether you should or should not take this vaccination. Then you'll stay in the car, take off your coat, but wear a short sleeve shirt under it so you can roll up the sleeve, and our nurses and medical providers will give you the vaccine as you sit in the car. Then you're going to remain parked for 15 minutes. So we call it drive-through, but it's really drive and park. And this is the national standard. We are going to have medical staff on site, and we're asking you to stay for 15 minutes so that you can be observed. Now, I got the shot 2 weeks ago. I had no effects at all. Other people have sore arms. Some people have felt achy. And once in a rare case, there's an allergic reaction, just like with any other vaccine. And I don't want to say this has no risk. Anytime you have a vaccine, there's some degree of risk. I believe it's minimal, and certainly if you look at the fatality rate and the long-term implications of having COVID, in my judgment, the risk of a vaccine is minimal compared to the risk of COVID, but you're going to make your own decision. But I'm not going to tell you there's no risk, which is why we're going to have medical staff on site. If you do have an allergic reaction, we'll have people there with Benadryl, with epinephrine, whatever it may be, but you're going to have to stay for 15 minutes because we want to make sure that you're okay. After that, you'll get a certificate from our staff of your vaccination, and you'll leave. And for most people, it'll be fine. I believe beginning to end, it'll be less than 1 hour. That's what you should plan on from the time you drive up to the time you drive out, and you won't have to leave your car. Remember, these vaccines take 2 shots. So I had one 2 weeks ago. I'm getting my follow-up shot on Tuesday. If you're going to have 95% effectiveness, you need the second shot. And so when you call the call center, they will schedule you both shots dates, 28 days apart. So you'll know right away, my first shot is January 22nd, and my second shot is February 19th. Whatever the case is, you'll have those scheduled, and you'll come back and do the same thing 4 weeks later. So, if you want to be in the first 20,000, how do you schedule an appointment? First, please wait till 9 a.m. on Monday. Nobody's going to answer the phone before that. Quicken is training the staff right now. They've been phenomenal, and they are ramping up. They're going to have huge call volume starting Monday, and they're ready for it. But you call at 9 a.m. on Monday, and when you call, you're going to get a lot of folks who have had the COVID test before know. You'll get a prompt that says if you want a test, hit one number. If you want a vaccine, you'll hit the other number. You'll hit the number, and you'll go to the person who schedules the vaccine. They will set 2 appointment dates there, one for the first shot and one for the second shot. You'll do that in the first phone call. You can schedule everybody in your car at once. So your good neighbor can call, and the good neighbor can register you and them on a single phone call. That'll be just fine. Whoever is going to be on your car, if they can be in the same car in the call, that's great. If you don't live together and it's 2 different calls, that's fine too. But we want to group this as best we can. We are going to start Monday, and I don't know how long it'll take through the week, but we are just going to go straight through and schedule the first 20,000 appointments. Now, if the governor calls me in a week and says I have a lot more vaccines, we'll open it up and we'll go to 30,000 appointments. But right now, this is what the governor felt comfortable saying that she believes will be available. And I don't want to make this sound like a guarantee. We've all seen the unpredictable nature of the federal distribution so far, but we feel pretty good that we're going to have 20,000 doses over the next 4 weeks. Who else can get a vaccine? The governor put in another classification, and she calls them Group B essential frontline workers. Basically, the only folks we aren't reaching in another way are K-12 teachers and child care workers. So if you fall in that category and you don't have another way of getting it, you can call and we will schedule you. You're going to have to give your employer information, and you're going to have to show your pay stub when you show up. We want to make sure that people over 75 don't lose their spots for younger people who didn't actually have a basis for it. But if you fall in the Group B essential frontline workers, we will schedule you as well. I expect the great majority to be our seniors. Here's the thing that's really important to remember. TCF is only one of many locations. Okay, so you are going to have across this city, a lot of doctors' offices will have shots, a lot of pharmacies will have shots. So if your doctor or your pharmacy is having a shot, by all means go to them. But the only thing that we ask is, we'll have the list, is if you call up and you're scheduled in 3 weeks at the TCF center and your doctor gets you in, please call and cancel so that we can make that slot available for another senior who needs it. But I want everybody to understand, the City of Detroit strategy is just not one building TCF. It is all of the pharmacies and all the healthcare providers who all have their own sources of supply from the governor, from the federal government. But the largest site in Detroit is going to be at the TCF Center. That's the overall picture for the public. The other thing the governor did yesterday is she opened up a category for essential city workers, which we are going to start to provide at our job site. So frontline workers who engage with the public. And so starting tomorrow, the Detroit Police Department and DDOT will begin to get vaccinated. Again, not mandatory. Nobody's going to twist your arm. I've got more people who desperately want this vaccine than we can service. We don't need to pressure anybody who wants to be in the second phase. And so starting tomorrow, DPD will get their shots at the same place the fire department did over at City Airport. DDOT, we will be at the Gilbert and Shoemaker terminals, and we're going to give people their shots at the end of your shift. We're not giving anybody a shot and then sticking them in a car and putting them out to work. It's rare that you have a serious side effect, but we're not taking any chances at all. So you'll get the shot at the end of your shift. We will pay you an extra hour of work for getting the shot, and you should go ahead and take advantage of that. And we think we will have offered by the end of next week to all of the DPD and DDOT staff, and then we'll move on to the other city departments that have face-to-face contact. Two of the people who have been wearing me out for the last few weeks over when can we get our vaccines have been Chief Craig, who, as you know, had his own serious bout with COVID, and the president of the Lieutenants and Sergeants Union, Mark Young, who is basically evangelical about the importance of this. And with that, I'd like to turn it over both to the chief and then to President Young to talk about how this will work with DDOT and the rest of the city employees. So, Chief Craig.
Good afternoon, and I want to begin by thanking you, Mr. Mayor, Detroit Fire Department, our Health Department, and Henry Ford Hospital for their ongoing support through these very challenging times. I am so excited about the opportunity for our department members to receive this vaccination against this COVID-19 virus. Many of you, as you're aware, and the mayor indicated, I had to battle COVID-19, and believe me, it was not easy. This virus continues at times to attack, and however, through faith and determination, I fought this disease and recovered. For me, the key to overcoming this disease was to continue to move and never give up. Many of our members faced the same challenge. At the height of the first wave, as you've heard me talk about, we had at one point 650 of our members quarantined. Overall, to date, since the beginning of this pandemic, we have 500 members that have tested positive, and tragically, several of our members have passed due to the complications from COVID. They are as follows: Captain Jonathan Purnell, 911 Dispatcher Sean Pride, Chaplain Corps Commander Valerie Parks, Detroit Police Reserve Captain Ernest Robinson, and Detroit Police Reserve Officer Gus Hughes. And of course, just recently, losing a great leader and my dear friend, Sheriff Benny Napoleon. Even today, the pandemic is continuing to have an impact on our department. While we have it largely under control, we currently have 39 members sworn, 35 sworn, and 4 civilians in quarantine, and 29 members whose last test result was positive. However, over 1,400 members have returned to full duty status. So how this is going to be facilitated, as the mayor indicated, fortunately through this collaborative effort, we can begin vaccinating as early as tomorrow at 1 p.m. I, along with my First Assistant Chief Stair, Assistant Chief Bettison, and certainly Lieutenant Mark Young, will all go together and get our vaccination at 1 o'clock. These vaccinations are strictly voluntary. We will begin utilizing the Pfizer vaccine at this time and may begin using Moderna vaccine at a later date. Each command will be given a set number of testing slots based on the number of individuals assigned to each command. Supervisors will then schedule their members for testing slots. Members who are apprehensive about the vaccine have an opportunity to attend a virtual town hall meeting by our Dr. Robert Dunn, Public Safety Medical Director, to provide additional information on the vaccinations and answer any questions. Additionally, fact sheets will be provided to the members on both vaccines. I truly believe this vaccine will benefit many in our community, but all of us must continue to be responsible and make the efforts needed to keep this virus under control. That includes continuing to wear masks in public, adhering to social distancing, avoiding large gatherings, and frequently washing your hands. As this pandemic continues, it is vital that we are able to remain vigilant in protecting ourselves, our loved ones, and the community around us. As I mentioned yesterday during a press conference, in order for us to collectively reduce violence in our community, we must assertively get this pandemic under control. So with that, I close. I want to thank you. Certainly, I bring someone who has been a partner, a friend, and a leader. I like what the mayor said, angelic, about getting this vaccine, and that's Mark Young, president of the Lieutenants and Sergeants Association.
Thanks. First of all, thank you, Mr. Mayor. I appreciate you, Hakeem Berry, and of course, Chief Craig. I appreciate you for helping us on many issues. If you know me, I believe that I represent the Avengers, the real life Avengers. They don't get paid the money and everything else, but if you know me, I'm a big Avengers fan, and we were in Infinity's war with this virus. Now we're in the end game where we win, and that's the goal, to win. The people that I represent face unknown danger every day, but the virus is a different type of danger. When you're out there on the street, you know the danger that you face. You train for it. We train well for it. But the virus is a danger that we can take home to our families and people that we love. I am excited about this. I understand that some people have concerns about the virus, and I'm a solution-based leader, and I'm a forward-thinking leader. That's why I want to be one of the first persons to take the vaccine too, because I need my people to earn. They've earned their retirements. I want them to see out their retirements. I want their families safe. I want this community safe. And there's no such thing as social distancing and policing. We're responding to different locations where it's close contact, saving lives up front in a scout car. So I'm excited about this. I am excited, and I understand that some people are apprehensive. I hope that after Chief Craig and myself, tomorrow that some other people understand how important of this. Captain Jonathan Parnell was my best friend, and he suffered COVID and he died March 24th. I'll never forget that night on a Tuesday, and it stuck with me even to this day. Almost a year ago, believe it or not. With that being said, Sheriff Napoleon was one of my early mentors. I want to make sure that we have all the tools necessary to be able to provide for this great community. Mr. Mayor, once again, thank you for pushing it up, and Chief, I appreciate you.
Thank you, Lieutenant. When COVID hit last March, the city of Detroit became the first city in America to go into every nursing home and test every single resident, and we cut the infection rate and the death rate dramatically. We went out to every single homeless shelter over and over, and you did not see the kinds of infection rates among the homeless in Detroit that you saw in other parts of the country. We care about our most vulnerable citizens, but we don't just pay lip service to it. We deliver. And Denise Fair, the health director, has been leading this effort. And when the governor allocated these vaccines, she said, I want to do it again. I want the City of Detroit Health Department to go out to those who might not be ambulatory, who might not find their way to TCF Center. I want to find the most vulnerable, go to them at their locations and get them vaccinated. And so the Health Department has an outreach plan. With that, I'll turn it over to Director Fair to talk about how she's going to do it.
Thank you, Mr. Mayor. So the third part of our strategy is to focus on those who are living in congregate settings, and that's our most vulnerable. Those are our seniors and people who are experiencing homelessness. So our outreach strategy is to go directly to those seniors, to homeless shelters, and bring the vaccine directly to them. So again, our vaccination efforts will begin at Boulevard Manor this Friday. And let me just say that the majority of nursing homes, adult foster cares, homes for the aged, and also senior apartments, they already have a vaccination strategy. But the health department, again, will start this Friday at Boulevard Manor. Next week, we'll go into 29 homeless shelters and 60 senior apartment buildings, again, starting next Wednesday. It'll take us roughly a couple of weeks. Trying to go back on this. Thank you. It'll take us roughly a couple of weeks. Our goal is to finish all 89 by the end of February. I realize it's another aggressive timeline, but it's important that we get the vaccine to those who are our most vulnerable. Now, I do want to thank Wayne State University, specifically Dr. Paul Kilgore. He immediately called and said, what can I do? How can I help the city of Detroit? And so their medical, their nursing students, their pharmacy students will help us and partner with us on this effort. Now, the health department is committed to protecting the health and well-being of all of our residents. And as the state continues to roll out this COVID-19 strategy, we will ensure that the vaccine is available to everyone who wants it. And as we work through vaccinating essential workers, DDOT, DPD, and others, I ask for your patience as we move through these phases with our partnership with the state. Until then, as I always say, I'm encouraging all Detroiters to do what we already know, which is to wear our mask at all times when we are in public, wash your hands, practice social distancing, and avoid large crowds. Please stay home if you are sick and seek medical attention if your symptoms do get worse. Also, if you do have a case of COVID-19, reach out to those who you may have been in close contact with and let them know, because it is the right thing to do. Now, the vaccine is a very important step to helping the city recover from this pandemic. But please remember that even after you have been vaccinated, you still need to follow those COVID-19 preventions, as I already mentioned. We're going to be wearing masks. We're going to be practicing social distancing for quite some time. So please continue to stay safe. You can go to our website at detroitmi.gov/health for the latest updates. And with that, I'll turn it back over to the mayor.
So in the NFL and the NBA, they do quite a bit of celebrating over their most valuable player. In government, it doesn't really work that way, but for the last year, there's no doubt our most valuable player has been our Chief Operating Officer, Keem Berry. He's rarely in front of the camera, but he is the one who orchestrated probably 200 city employees, all playing a key role in the testing site, Nobody had ever put together a testing center like that before, and the complexities of sorting out labs and medical records and appointments and everything else was amazing. Now, he has to do something else nobody's ever done before, which is figure out how to get 20,000 people vaccinated in the next few weeks, and he knows his reward for that is I'm going to ask him to get 40,000 vaccinated in the 4 weeks after that. But with that, I want to turn it over to our Chief Operating Officer, Hakeem Berry.
Well, thank you, Mayor. You know, if you know our mayor, he wants us to be the best for our City of Detroit community, and so we've been tasked with putting up a testing or a vaccination site, much like our testing site. And so we want to make sure that we have that same customer service experience. For those of us that are fearful of needles, that's all we want you to remember about the experience and coming to get a shot and not a 10 or 15-hour wait. So some of the things that the mayor stressed is that scheduling your appointment is very, very essential so that we know when you're coming. We can make your experience smooth and in and out. I'd like to thank a few people that was able to help us get this TCF up and running first. You can't say anything without thanking the governor and Dr. Caldoun for committing to us to get us the vaccines to help. And as much as they can get, we will work it out and get these into the arms of those that need them. Henry Ford Health System, who stepped up and helped us out to vaccinate our first responders, starting with the fire and EMS department and now the police department. DMC has always been a partner in anything that we need in our medical standing up. Dr. Phil Levy in Wayne State University, who will be doing the vaccinations for our DDOT employee, and he's always willing to continue out into the community and partner with the health department. The TCF Center leadership, they didn't laugh at me when I called and said, we need to modify your building so that we can accommodate up to 5,000 Detroiters coming through. So they rolled their sleeves up and said, whatever you need, we will be there. Dan Gilbert, Quicken, for the call center, and particularly Jared Fleischer, who, you know, he never says no. So whenever we need to make a modification, it's there. Chris Illich, who continues to offer the support so that as we expand and in better weather, we can expand to some of the garages that are available from the Illich properties. And just our staff. The mayor said we got, you know, several hundred people, great people with the City of Detroit that come together in this time, and we can stand up these operations. Particularly our heads of that has been Elisa Malil, who's our Deputy Chief of Staff, Jeff Klein, who's one of our Chief Architect, and Al Prasniak, who has been the master traffic planner that allows that traffic flow to go through. And I'll cut off my Academy Award thank you speech before the music plays and turn it back over to the mayor.
So I want to say to the residents of the City of Detroit, you've seen the images on TV in the City of New York where people lined up in traffic jams. You've seen the images in Florida where 75-year-olds sat on chairs overnight. My mother's 83 and down in Florida, and she calls me daily. She wasn't motivated enough to sit out overnight in a chair. But there's a lot of anxiety in how does this work. And so you're going to get a chance to see how the City of Detroit functions starting on Wednesday. And I'm confident that we will get you in and out in an hour. We'll do it safely. And we know the reality. When you give 20,000 vaccines, we are going to have some reactions. It may be 1 in 500 or 1 in 1,000, but we are going to have medical staff there ready to respond. And I think the great majority of people will be like me and have no effects from it. But everybody's body reacts differently, and we want you to know that if you're one of those rare cases that has a significant allergic reaction, we'll have medical staff there for you. And with that, we'll open it up to any questions.
Happy New Year, everyone. Mayor, thank you for today's opportunity and the look ahead. Today, 1,808 people have been vaccinated in the city. In general, who are those folks? And does that number seem, it's off the dashboard today. Perhaps the number is changed.
Whose dashboard?
States.
Okay, so we don't really know So the early phases, the state sent vaccines to Henry Ford, they sent them to DMC, they sent them to CVS. And so you would have to ask the state of Michigan that. What my conversation with the governor is send the vaccines to us. And my friends at DMC and Henry Ford in the last 48 hours have both called and said, this is not the way to do it. We need to recreate the state fair. So Denise, what are the numbers on the Detroit Health Department, the vaccines that you have received?
Sure, so we have only received 2,000 Moderna vaccinations. Now, the entire state actually received, the entire city of Detroit received about 50,000, but again, it's only 2,000 allocated to the City of Detroit Health Department.
And they went to firefighters, health workers?
Yes, homes, the home for the home health agencies, some of the like Wayne State University, some of the pharmacies. I mean, so it's been distributed pretty widely.
Right,
So early on, Mayor, are you happy with that, or you wanted to see a more bold approach?
Yeah, I did an interview in November on one of the national TV shows, and they asked me about people being reluctant to take it. I said, you're asking the wrong question. The federal government has absolutely no plan to distribute these vaccines, and you guys are failing to focus on it. Now I think the country understands. The federal government never had a sensible distribution plan. And I've talked to the governor repeatedly, and the fact is they don't know from one day to the next how many are coming. Then they've got to decide between 83 counties. And within the 83 counties, they got to decide what hospital gets it, what pharmacy gets it, what health department gets it. And so you're hearing the same story from states across the country. I'm not really interested in looking backwards. What I said to the governor, I talked to her the day after Christmas, is we at the city of Detroit can do more vaccinations in a shorter period of time than any entity here. We've got DMC and Henry Ford and the health providers helping us. They all believe in our process. Get us a commitment to the flow of vaccines, and we will get the vaccinations done. And the governor, I think, believes in that. And so I can't go backwards, but we've been very anxious to have 4,000, 6,000, 8,000 vaccines a week come to us, and I'm confident they will come to us, and then we should be measured on how we do with the ones that we receive.
Mayor, the 40% number who may be interested in the vaccine, where does that come from?
So I would say two things. One is if you look at the surveys, and there have been a number of published surveys in Detroit and nationally, Detroit's a little bit lower nationally. The African-American community has got sound basis for being suspicious of the federal government and medical treatments that we have to overcome as a community, and my own conversations. But I think if you just talk to people that you interact with in this city, everybody else can have their own, I got 40% who want it now, and all they want to know is how can they sign up. And there's 20% who don't believe what anybody says, they're not getting it, there's nanobots in it or whatever. But there's also 40% who say, I know it's probably good, and I know I should get it, I just don't want to be first. And that's okay. So the 40% that want to be first are going to be able to call Monday morning and can start to be first. And I just think it's going to solve itself. When the first 200,000 Detroiters get vaccines, everybody else will know people in their family, their neighbors, their friends. And all you have to do, what Moderna and Pfizer did, I spent 9 years in the hospital field. What they did is remarkable. The data behind it, the research, the science behind it, 95% effective rate on a vaccine, and they're not injecting you with a live vaccine. It is a truly remarkable accomplishment, and everybody who understands it is signing up. Folks who don't really understand it say, how come they couldn't cure cancer and they cured this so fast? Those folks are going to have to wait and see other people get it. That's just the reality, and I don't spend a lot of time arguing. I say wait until you see the other folks, and you can make your own judgment.
Mayor, last one for me. If the response early on in the next few days, next week, or maybe beyond, is not as robust as you would hope, is there a plan B to kind of get things moving?
We're going to handle this exactly the way we handled the testing at the fairgrounds. So those of you around in March, first, you had to have a prescription called in by your doctor. Then you just had to have a prescription. Then you had to have symptoms. Then you had to work in it. And we just kept expanding it because we knew we could do 1,000 tests a day, and we kept expanding the eligibility. And so this is going to be very simple. If we don't fill up the first 20,000, we're going to lower the age from 75 to 72, and we'll open it up again. and we'll just lower it to 70, 67, 65. We're just going to keep expanding the category. If the governor calls me next week and says, I've got 10,000 more vaccines than we thought, we'll probably lower it from age 75 to age 72 next week. And so we will have throughput at the TCF Center, and we would just keep expanding eligibility to fill it up.
Hi, everyone. Thank you. Mayor, just following up briefly on what Sean was talking about, just to be clear on the hands-off as far as advising people what to do, voluntary, but yet you've been public, obviously, 2 weeks ago, getting yours here. Is there any communications at all to encourage people? You talked about the 40-20-40, or do you consciously just say, hands off, we're not even going to communicate or encourage anyone?
Oh, no, you look on the city website. Denise Fair encourages people every day. Yeah, go ahead.
Yes, you can go right to our website
How
right
proactive,
now.
I guess, is my point.
I'm sorry?
How proactive is the messaging, I guess, is my point.
So this is public health, and
Right.
so we are going to be extremely proactive. Our goal is to get, as Dr. Caldoun says, we want to get shots in arms. And so we want to provide as much education as possible. This is something new to everyone, and we want to calm people's fears and provide as much information as possible. So people can go to our website right now, detroitmi.gov/health. There are FAQs on there right now, and you can send us an email if you have questions. We're very responsive.
And I'm
And
curious.
I want to be clear, talk is cheap. So there's a reason why Denise and I went and got our shots on TV. The chief is going to do a Facebook Live shot tomorrow. We think we ought to speak through our actions. I am 100% confident that the risk of COVID is dramatically higher than any risk from a vaccine. And so I knew when they stuck the needle in my arm, there is a minuscule chance I'll have a bad reaction. There is a far greater chance I'm going to get COVID and have a serious effect if I don't have that vaccine. That's a choice I make. It's, I think, a very well informed choice, but that's why we're acting through actions and not through words.
Curious, appreciating who you're prioritizing and that the vaccine availability is a moving target, but I'm curious, charting out the majority of people that are younger, in their 40s, 30s, et cetera, on down, do you see this process going forward into June, July, August?
Oh,
Do you have any-
absolutely.
What's your thought on timing?
Absolutely. So we know in this city, we have approximately 40,000 people over the age of 75. We have approximately 100,000 over the age of 65. We've got all the demographics. But I certainly would hope by April or May, every adult in this city who wants to get vaccinated can come through. If we could do 5,000 vaccines a day, and I'm confident that Hakeem Berry can run an operation that's 5,000 a day, we'll do it. We need to know the vaccines are there. And right now, the vaccine availability isn't higher than 1,000 a day. But as soon as it is, we're going to ramp up to everybody.
My last question, forgive me for being off topic, but while I have access to you, is regarding the events in Washington yesterday. The focus, though, I would like you to comment on is moving forward, in that some have expressed they hope this could be a bellwether moment to temper down politics, to maybe stick to more fact-based politics, however you want to frame it. And we've had our issues on a state level as well, obviously. How do you see this moment? What do you hope for this moment? Any thoughts in regard to having to change the narrative so that people are dealing on the same truth table, for lack of a better way to ask?
You know, if you're looking for somebody to calm it down, it's not me. I mean, it was an act of sedition. There's no other way to describe it. I was very disappointed to see the Secretary of Transportation resign today. The last thing we need is the cabinet people to resign. We need them to use the 25th Amendment and sign the letter and get this president out of office before he does something irreversible in the next 12 days. I'm very concerned about what is going on. I'm very concerned about the cabinet not stepping up to their responsibility. I just can't even imagine. He stood there and fired these folks up and sent them across the way to the Capitol building where his own vice president was presiding as an effort of intimidation. If that doesn't justify the cabinet invoking the 25th Amendment, I don't know what does. I was one of the first elected officials in the country that got behind Joe Biden. He's a good man who will bring people together. But I am worried for the next 12 days.
And I appreciate that, but what I really wanted to focus on as well is your thought on moving forward off of this. I mean, a lot has been said in regard to those who helped get us to this position politically, and, I don't want to devolve too far, but some are saying this could be a moment where we reexamine, how the game is played, for lack of a better way to say it.
I don't know. I don't know. You got media outlets whose entire rating and business model is based on pitting people against each other. Are they going to re-examine everything they've done, or are they going to wait for this to die down a few days later? I think the future is Joe Biden and Kamala Harris. I think they're going to unite this country and try to bring people together. We got 12 days to get through.
Mayor, can you talk about your communication with the Biden administration as it relates to the vaccines and providing them?
So, well, the Biden administration at the moment doesn't have the vaccines. Jeff Zients and I have been texting, and he's going to be a leader in that, and he knows Detroit is ready to go. But if you were to say to Gretchen Whitmer today that I can promise you, you are going to have 100,000 vaccines a week for the next 8 weeks, she could plan. Nobody's saying that. And so we need that kind of distribution from the national level. And when we get there, you're going to see a far more efficient system. And you see it in states all across the country. The governor of New York is threatening to fine the hospitals for not getting the vaccinations done. I ran a hospital. Hospitals are designed to get you in for 4 or 5 days and make you better. They aren't designed to give vaccines for 500 or 1,000 people pouring through and going out. So hospitals across this country have been failing to distribute the vaccines in the numbers people wanted. It's not their fault. It wasn't what they were designed to do. And I think you're going to see more and more people in this country do what we're doing and have large-scale drive-through vaccination sites. It is going to be, I believe, the only way vaccinations get done in any kind of reasonable schedule.
Hi, good afternoon, Eli Newman, WDET. First question for Director Fair. I'm wondering, as we're talking about the need for congregate settings to be in line for these vaccinations, has there been a discussion about the Detroit Detention Center, and when can we expect that kind of them to be part of this vaccination plan?
They're already a part of this plan. That's covered by the state, and so the state has allocated a set number of doses for the staff. The health department has partnered with DRC. The first step is to vaccinate staff, and then also the non-healthcare staff. So that's underway.
Okay, thank you for that. And again, concerning the events that happened in the Capitol yesterday, Chief Craig, I'm wondering if the department is having a current conversation with federal investigators about potential city residents who may have attended, if that's an ongoing conversation.
I'm aware that some who attended from Michigan have been arrested. In terms of us, the Detroit Police Department having a direct conversation, that has not happened. But I have had a number of conversations in terms of our preparedness and response. But there's been nothing that's come up on the radar in terms of any problems in the city of Detroit. But as I indicated to the press earlier today and yesterday, we were prepared in the event there were going to be protests that could have turned violent.
Sure. And lastly, Mr. Mayor, I guess I'm wondering, does the city of Detroit believe that the police reform movement and associated groups like Detroit Will Breathe present more of a threat than the pro-Trump Stop the Steal movement? And if not, how do you reconcile the differences between the arrests that we see between the two groups?
Again, I don't see either of them as a greater, I don't see Detroit Will Breathe as a threat. I don't, the way our Detroit Police Department has functioned, I don't see any of them as a threat. We had a significant threat to the city the first couple of days of the protest with huge crowds, and it was Detroiters stepping in, stopping people from out of town. That's the reason that Detroit is about the only city in the country that didn't have any stores looted or any fires. But the response to every protester is based on their behavior. It has nothing to do with who the organization is. When you assault police officers, they respond. But if you go back to the first couple days of the protests after George Floyd's murder, the Detroit Police Department was passing out masks and water bottles to the marchers. The great majority of the members of the Detroit Police Department were on the side of Black Lives Matter in that George Floyd protest. What happened over the course of the summer had nothing to do with those issues. It devolved into issues about socialism and other things with largely protesters who were outside the city. But the police department responds based on behavior. We believe in free speech, and we treat everybody exactly the same. And I'm pretty sure the chief would agree with me on that position.
Thank you, Mr. Mayor. Absolutely. That's something I've been saying all day. In fact, I've said it to you recently, and if you want me to reiterate that again, we focus on behavior. We don't read banners and signs to try to figure out who's representing what. We respond to behavior. And when you look at the protests over the summer, 100-plus days, and there were 7 times where we had some challenges, whether it was through resistance to a lawful arrest or our police officers being attacked, that's when we responded. We recognize that vast majority of the protesters who marched were peaceful.
Great, thank you.
I have just a few questions from Annalise Frank, who's watching from Cranes. Is the use of the TCF Center garage being given, donated, or is the city paying to use it? And if yes, how much?
What's the term of the rent, Hakeem?
I believe it's like 45,000 a month. It's not being donated. We signed a lease for it for at least several months for now. Hopefully we can get through a lot of the vaccinations by then.
Okay. And how much is the total vaccination effort costing the city?
We will find out, but right now, we're doing it exactly the way we did it on the testing side. We got the system up and running, and as it turned out, the federal government reimbursed us for all of our costs. I'm quite hopeful that the federal government will reimburse us for the vaccination. It was just a significant federal appropriation for vaccination costs. But we're not sitting around waiting for somebody to sort out the bureaucracy on the money. We're going to get Detroit residents vaccinated now, and we will figure out how to get reimbursed later.
Okay. These last 2 are related to staffing. Where is the workforce to administer the vaccine coming from, and how many staff will be involved in the effort?
We have recruited as we do with all of our sites, we've recruited medical staff to provide the vaccination. It all depends on the amount, but if we get up to 5,000 vaccines a day, you could see a team of at least 155 people out there to assist. And these are not all vaccinators, but it's the medical evaluator, the person that checks you in, the one that's monitoring your conditions after you leave, or before you leave.
So basically, we're going to have a team of 4 people for every 6 or 12 cars that will be monitoring individual rows, and it's a combination of private medical staff, city employees, and contracts.
Okay, last question. If members of the Detroit Health Department are doing this, are any coming from other tasks, say the testing site? Are they being drawn away from their other responsibilities?
The testing site's fully staffed up.
Right, yeah.
We've always, again, you go back to what we were doing, we were running 1,200 tests a day at the same time Denise Fair's team was out in the nursing homes testing. So we're used to doing more than one thing at once. But anybody who wants a COVID test can call and get one tomorrow at the Williams Rec Center. You can call the same number and you can get in tomorrow. We are not reducing our testing at all.
Thank you.
All right? Oh. Go ahead.
Good afternoon and Happy New Year.
Happy New Year.
My name is Mary Marini with the Detroit Free Press. Quick question. In addition to going to the 60 senior center living facilities, what efforts are being made to reach senior citizens who do not live in facilities?
So that's the rest of the program. It's everything we've laid out. And so at the nursing homes, there is an effort with the state of Michigan in partnership with the pharmacies and the health departments picking up those that are being missed. But we will continue to do what we did on the testing site, which is at some point, as we get through the first phase of this, we'll offer free transportation as we did for people who couldn't get out of the testing site. But I am really hoping this good neighbor strategy will work, because we are saying to folks, if you're 65 and up, go to your neighbor who can't get out, drive them, and not only are you doing it because it's the right thing, but you can get vaccinated as well. And I'm hoping that the Good Neighbor outreach, and I'll be having a conversation with most of the ministers in town about trying to partner with these good neighbors, with these homebound folks or people who might have cars, and we're going to see if this works.
Yeah. And we receive dozens of emails from elderly readers who are confused about the process, who aren't really sure what to do to get vaccines. Will there be any sort of email outreach or outreach on social media to break down the process for them in addition to the website, or how is that?
Yeah, so our health department has an active social media campaign. Our partners in the healthcare field do, our churches will, but it's really simple. Dial the telephone number. There's nothing complicated about the process. Dial the telephone number, and we'll schedule you in.
Perfect. Thank you.
Mayor, just one final question from Kim Russell at Channel 7. She was pointing out, as Sean Lay did, the numbers that are on the state dashboard in terms of who's been vaccinated so far, and the numbers show that Detroit has been well below the state average, both numbers very low. And she wanted to know that, given the history of medical inequity in minority communities, what does the city need to do to make sure that there's a deliberate attempt to make sure that Detroiters are getting their vaccines?
We open up a TCF center and we schedule 20,000 appointments. So I'm not, my place isn't to criticize. The early phase was put it out through the hospitals and the pharmacies, and given the fact that healthcare workers were in the first phase, that made sense. But it was clear to me that was never going to work on a large scale. And so by Wednesday, the largest single vaccination site in the state of Michigan will be operated in the city of Detroit, and that's how we deal with the inequities, is we organize better and more efficiently, and we make it more accessible. We understand it was slow getting started. We're stepping in, and now this is, starting tomorrow, the city of Detroit's plan.
Okay, and I forgot, there was one additional question to follow up on the presidential topic. Are you planning to go, or have you been invited to the inaugural?
I'll be there virtually.
All right, thank you. That's all.